So today we're going to talk about a difficult subject, how to know when it's time for your beloved pet. Welcome to Canine Wellness Online. I'm Tania Costa. I work with a lot of senior dogs, and it's a question I get asked weekly with my senior patients. Some of my clients will ask me, will you tell me when it's time? You know, and I do that for some of my clients. But what I want to talk to you about today is a tool you can use to help you be more objective rather than subjective. And what I mean by that is often, because you live with your dog, you don't see subtle changes until they become really obvious. And then all of a sudden you're like, oh, wow, he can't get up, or he fell, like yesterday with Jake, my senior dog here. He went to get up and the floor is slippery and he just kept falling. He couldn't get up and I helped him up, which is what prompted me to make this video. So this is Jake. He is 13 and a half. Come on, bud, let's go. Good job, good job. And quite frankly, 7 years ago, he was diagnosed with DCM, which is dilated cardiomyopathy. So basically an enlarged heart. And in his case, it was caused by grain-free food. But he was given a year, 2 at best to live. And you can see here, it's 7 years later and he's still around. One of the hardest things when deciding when it's time is understanding your dog's pain. I think what you need to look at is if you can't manage your dog's pain, then you have to start thinking about their quality of life. Everybody's going to have a different opinion, and that's your right. But for me, it's more important for quality versus quantity. So for example, if you have a dog that is pacing all the time, panting, especially in the evenings, and difficulty, just could barely walk, that might be something to consider in your dog's quality. I remember years ago, I had a client that had a dog who basically couldn't walk at all. It was a large dog, and we had a discussion about quality of life. And for her, she said, well, you know, my dog used to chase the bunny rabbits outside, but now she can't. But at least she can lie there and see them. And it really made my head spin, because is it really fair that your dog that loves to chase the squirrels or the bunny rabbits is lying there, can't get to them, and is just lying there staring at something she can't get to? I don't know, you tell me. But I don't want you to confuse a lack of mobility is not always pain. So if we look at Jake, he's slow. He stumbles a little bit, has difficulty getting upstairs now.
And he still enjoys going to the beach and playing with his favorite Whirly Whirl toy.
But it's not pain related. It's actually neurological, and I've talked about this in other videos. It's his proprioception. And what that means is, neurologically speaking, the nerves are not firing as quickly. So one might look at him and think, oh my God, this dog is in so much pain. He's not in pain. He just lacks mobility. Now, with Jake, if he couldn't get up at all and not use his legs at all, I might have to consider about how I want to manage that. For some, a wheelchair is an option. For others, it might not be an option that you want to look into. So another consideration is that comes along sometimes with this neurological aging, I call it senior dog neuropathy, is incontinence, bowel and bladder. So some dogs, when they're like Jake is, or a little bit worse, they lose bowel and bladder. and they'll wake up, and the owners wake up in the morning and soiled their bed, peed their bed. And again, I'm not sure that's something that I would want my dog to have to go through, but for others, they just march on and it's fine. So now let's talk about how you can objectively determine.
And I just want to share this scoring system with you, which is one of the vets that I work with in Toronto who does hospice care and end of life care. And she's created this amazing scoring system which will help all of you in being objective about where your dog is at. Let's look at how we can score. So we go in here and just know that a high score, so a 5, is really good, and a 0 is not so good. So we look at breathing. So I look at Jake and I say he's breathing normally, respiration rate of 30 breaths per minute. And perhaps what I'll do is I'll do another video on how you can get the respiratory rate. But his isn't perfect because of his heart. I would say he is a 4. And then I go pain. So he's not showing any signs of pain. So I'm going to give him a 5. Appetite and hydration, he's a 5. Energy and interest, so showing normal interest in daily routine and activities, I would say he's a 5. And then mobility, moving with good mobility, he's able to go for walks and perform regular routines. I would give him a 4. Even though he's got good mobility, I would say he has difficulty getting up. He doesn't have difficulty going to the toilet. Maybe I would give him a 4.5, but let's give him a 4.5. And then we go here to elimination and hygiene. So his is a 5, gives love and takes love. He's a 5. Happiness, he's 5. He is sleeping a lot more, so I would give him a 4. And anxiety, he's not showing any signs of anxiety. His will to live, he definitely has a will to live. He is not a burden on me, maybe slightly, when he falls over, but that's negligible. So I'm going to give him a 5. Disease, he's doing well despite having his heart condition and another condition as well, which I haven't discussed. But so I'm going to give him a 5. And overall, I think he has a good life right now. And he has more good days than bad days. In fact, he doesn't really have any bad days per se. So now what we do is we take this score and it does the math for you, thank God, because my math sucks, and divides it. So Jake is an 89.3, so he's excellent quality of life. Now, if we get down to somewhere between 0 and 25% in this box here, it's a very, very poor quality of life, and you must strongly consider humane euthanasia. Now remember, if some of these scores are low, there are things that you can do. And if you look in the description below, I have many tried and tested products that I recommend. Things like Pets PMF beds, mobility devices, things for pain. So please do check those out because they may actually help your dog have a better score.
Hopefully it helped you out. It helped me out. And now I have a baseline score for Jake so that I know objectively where he's at each week or each month or however often you decide to use it.